Good evening. My name is Sade Leeson, nurse practitioner student, and I'm going to be completing my head to toe assessment. I have already performed my hand hygiene, so I'm going to be assessing the head, and that includes assessing the skin to make sure that it is pink and nice, which it is. I'm also going to be checking the size of the head to make sure that it is appropriate for the body, and it is. I also will be looking for any abnormal movement or twitching within the face. Your face does look symmetrical, all right? And then the nasolabial folds, I'm also checking as well to make sure that it's aligned. I'm checking the eyes for symmetry, which means that it's on the same level, it's not lower than the ears. And then I'm going to be assessing cranial nerve 7, which is the facial nerve. I'm going to have you go ahead and close your eyes really tight. Thank you. And then open. All right. And then smile for me. Frown. And then puff your cheek. Great. And then now I'm going to palpate the head and the scalp, checking for any mass, indentation, infestations, or open or skin breakdown. So I'm checking to make sure. And then hair growth is appropriate. It's growing in. All right, great. So there's no opening or anything in the head. I'm gonna put on my gloves now, and I will be palpating the temporal arteries. So, okay, all right, they're equal. Now I'll be assessing the function of your trigeminal nerve, which is cranial nerve number 5. So go ahead and clench your teeth for me. Go ahead. All right. And then that nerve is responsible for any chewing or any mastication. So next I'm going to palpate the temporal mandible joint. All right. So that should be like right around here is where your mandible is. Okay. And then you're going to go ahead and open and close your mouth for me. And with this, I'm listening for any clicking or movement that would tell me that the patient has any TMJ. In this case, he does not. So now we'll be assessing the neck. So I'll start by palpating the anterior thyroid. Okay, going from behind, I'll be doing the posterior thyroid. Then I'll be checking the lymph node, starting with the periauricular. Then doing the post-auricular, which is behind the ear. Okay, working myself down to the occipital, and then the tonsilary. Okay, and then doing the submandibular, maxillary, sorry, and then the submental. Okay. So now I'll be also checking for the anterior clavicle. So it's gonna be like right here. And then the posterior clavicle, which would be just below that. And then we'll have the clavicle. And then the subclavicle. All right. And then with the palpating each carotid artery one at a time, I'll be using the bell of my stethoscope to listen to it, so I have the patient inhale, and then when I lift my stethoscope to exhale. So first palpate it, and then I'll be listening to the bell. Okay, and then on this other side too, sorry, palpate. And then I'll be listening with the bell. And this, I'm listening for any burette or any abnormal sounds. With my right hand, patient's gonna turn left, and I'm feeling the resistance. With my left hand, patient's gonna turn right, and then feel the resistance. Okay, now I'm gonna do the rapid alternating test. Patient's gonna pat the knee with palms facing upward, then alternating downward, and rapidly doing it. All right, thank you. Completing the fine motor and coordination, we're gonna do each finger to the thumb, walking through on one right hand, and then have it on the left. And then we're gonna do that test as well with my index finger. Patient's gonna touch my index finger, touch his nose, and then with the other hand, index finger to nose. Patient's gonna have his eyes closed, touch my index finger with his index finger to the nose, and then index finger with index finger to the nose. Good. Now we're going to complete the bicep testing. So I'm going to be using this for illustration as my hammer. I'm going to have the patient flex. Notice where the bicep is, just above the antecubital. Extend, and then with my hand, I'm going to use the hammer and tap, and I'm looking for contraction. So hammer, tap, and you see the contraction. Now with the lower, I'm going to complete the lower fine motor skills and coordinations, and I'm going to be doing that using the patella assessment. So I'm going to first, for location, just below the knee, just a little below the knee, and then behind the knee. For position, have the patient extend to make sure I'm in the right position, and flex. Using this as my hammer again, I'm going to tap, and then patient should have some, okay. All right. So with the continuation of the lower fine coordination assessment, I'm going to have the patient's laying down. I'm going to have him use his left heel to the right knee, slide it down and back up. And then the right heel to the left knee, slide down and back up. All right. And then I'm going to check for the great toe. So great toe assessment. Separation assessment. So with that, what I'm doing is I'm going to separate the great toe from the second digit, and the patient's going to tell me in what position I'm moving his great toe. So
towards me, away from me, to the right.
Okay, and I'll be completing the same on this side.
Towards me, away from me, to the left.
All right. So now I'm gonna do the vibratory test using the fork. I'm going to tap it on a hard surface, and the patient is to tell me if they feel a tingling or buzzing feeling. So when I tap, I'm gonna place the fork on the patient's great toe.
Yes.
And then I'm gonna tap, and then
Yes.
buzzing and tingling. Okay. Now we'll be completing the Romberg's test. Patient is in a standing position or upright position, and we're going to have him with his hands to the side, feet together. He's going to walk towards me. Okay, and then turn back, heel to toe. All right, then I'm gonna have the patient come back towards me with their eyes closed this time. And then turn back. And during the assessment, I'll be in close proximity to the patient, just in case the patient was feeling dizzy, lightheaded, or anything, or had an unsteady gait. I would be able to. All right, so to also percuss the anterior location, I'll be doing the same, and I'll be finding the angle of Louis, and then going ahead and percussing. Okay, and then again, if there were any abnormalities, there might be a variation on the left side due to the fact that the patient heart is variation in sound, because the patient heart is located on the left side. Okay, so now we'll be assessing the heart, and I'll have my patient either in a sitting position, a lying position, or a standing position. So he's in a correct position as far as sitting, and then I'll also have his chest exposed. So there's 5 points that we'll be checking, which will be the aortic valve, which we're checking in this second intercostal space. So right here. Pulmonic, which is on the left side in the second intercostal space as well. And right mid-sternum would be the Erb's point, which is below in the third intercostal space. And then we would have the tricuspid valve, which is in the fourth intercostal space, mid-sternum as well. And then we'll be going to the mitral valve, which is the apex of the heart, and it will be mid-clavicular, fifth intercostal space. So right where the breastbone is. Okay, so I'll be assessing all of that, and then I'll also be using, so with the diaphragm of the stethoscope. Okay, so there's also two sounds that we'll be listening out for, which is the S1 sound, and I'll be using the the bell of the stethoscope to listen to the S1 sound, and that's normally where the contraction of the vesicles for where the mitral and tricuspid valve closes. So that will be heard best at the apex using the bell. And that would also tell me if there's any issues or any problem. And then we would have the second S2, which would be at the closing of the ventricular valve, and that would be able to tell us, and also the diastolic start of the diastolic. So that will be able to tell us also if there's any issues, any problems that we may be having. Also, other two sounds that can be heard is the S3 and S4, and we also use the bell of the stethoscope. So that will be heard also in the second intercostal space. Okay, and there's no sounds. Now I'm going to be moving on to my it also tell me back to the S3 or S4 if there was any rapid or hard sounds. I'm going to now go to my respiratory system, and with that, I'm asking the client, do you have any shortness of breath, any chest pain? No. Okay, so now I'm going to locate the bronchial to listen, and that is normally mid or the trachea, around where the trachea is, but like just above the clavicle is where you would hear, and that is normally like a high-pitched sound. And then with the bronchial vesicle sound, it's the first and second intercostal space on the left. So it'll be first and second on the left, and then about the left border of the sternum, which would be like right here. And then with that sound, I'm listening to see if it's normally not soft, but like a medium sound. And then I'd go down to the lower of the left, for the vesical breath sounds is upper middle for the right, and then lower for the left that it can be heard on. So I'll be having my patient inhale and exhale as I listen to each breath sounds, and I'll be doing this in a snake ladder pattern, and then also on the lateral side at the sixth intercostal space. So I'm gonna have you inhale and exhale for me. Sorry. Go ahead. Good. Okay, and then we will start here. Sorry, I went kind of low on that one. Okay. And then on this side. Okay. Okay, and I'll also be doing the same in the anterior back of the patient as well, or the posterior part. It will be the same as far as the vesicles are located. And then in this one, I'll be percussing the costal vertebral angle for any tenderness or pain. So now we're going to be doing the heart. I have the patient in a sitting position with chest exposed. There's 3 positions this can be done, either sitting, lying, or supine. I'm going to be checking for the pulses. So first I'll start by checking for his radial pulse. Okay, and for this I'm checking for the strength and the strength and the equalness of the pulses. Make sure that it's equal. Then I go down to the dorsal tibial pulse, and with that it should be in the lateral aspect close to the ankle. So I'm checking for that. Okay, I feel the pulses, and then I'm going to check for the dorsalis pedal pulses, and that would be at the top of the foot. And I'm checking for the strength as well to make sure they're fine. Okay, so with this, I'm going to, there's 5 points of the heart. On the right side, you have the aortic, which is located in the second intercostal space. Right across to the left, you have the pulmonic, which is also in the second intercostal space. Below that, in the third intercostal space, you have the Erb's point. And then just below Erb's point mid-sternal is the mitral. And then you would have the mitral, tricuspid, which is in the fourth intercostal space, and then the mitral, which is at the fifth intercostal space, mid-clavicular aspect. And then, so I'd be listening. Okay, so, and for the mitral valve is also at the apex of the heart. So with this, I'll be listening with my bell for the 2 sounds, which is the S1 sound first. And with the S1 sound, that is located at the apex of the heart using the bell of the stethoscope. And that normally is when the contraction of the ventricles close at the mitral and tricuspid area. So using the bell of the stethoscope, I'll be listening. Okay, and then next is the S2, which could be heard in the second intercostal space, and that is normally at the end of the pulmonic side of the diastolic sound, and that I'll be using the diaphragm of the stethoscope to listen to. Okay, there's also 2 other sounds, which is the S3 and S4, and those are normally like you use the bell to hear for any rapid sounds or any abnormalities as well.
Okay, so now we'll be completing the range of motion of the ankle. So I'm having the patient lie in a supine position. I'm going to have them dorsiflex, with the legs extended, and then dorsiflex his foot towards him. Okay, and then I'm going to have them plantar towards the ground or far away from them. Good job. And then I'm going to have them do the inversion, which is putting the soles of the foot together. And then the eversion, which is putting the soles of the foot away from each other. All right. And then I'm going to, for the toe flexion, you're going to curl your toes. This could be a little bit difficult depending on if the patient has any deformity. And then you're going to do the toe extension. Okay. Then for the abduction, you're going to spread the toes. And then for the adduction, you're going to add the toe flap or close to you. Okay, thank you. And then I'm going to be doing the McMurray sign. So with the McMurray sign, again, the patient is lying in a supine position, and I'm going to have the knee flex with my hand under. So, okay, and then I'm going to rotate the tibial knee and bring them, okay, and then I'm going to extend, and when I'm extending the knee, in the, if I hear, I'm gonna do this a couple times, and then I'm checking for meniscus abnormality in the knee, so any damages that's done to the meniscus, that's why we're doing this test. And if I hear any clicking or any locking, that is a positive McMurray's test. So it's just fully extending, bring the extension and repeat, and then in a different position, okay. And then we're going to do a lateral rotation. All right, and then right here into the medial, into the lateral. Okay, and then extend. All right, so we didn't have any clicking or anything, so the patient is good. There's no torn meniscus. And I've completed this concludes the video. I have washed my hand, provide safety to make sure that the patient is okay, and then this concludes my head to toe assessment.